Hey there, and a very warm welcome to this explainer. If you're joining us today, it's highly likely that you, or maybe someone you really love, is on a path to building a family. And before we do anything else, I just want to start by acknowledging something super important. Navigating fertility care, it can be an incredibly stressful, emotionally taxing experience. So let's just take a deep breath, settle in. Today, we're going to set a really calm, grounding tone because this guide is designed to bring you clarity and, most importantly, hope. Now, are you feeling completely overwhelmed by all that fertility jargon right now? Yeah, I totally get it. I want to validate those feelings right out of the gate. Looking at medical charts or listening to specialists, sometimes it literally feels like you're trying to climb this mountain of intimidating medical terminology, completely without a map. It causes a ton of anxiety. But I want to reassure you right now, you are in the exact right place. We are going to decode all of this together. Because here's the truth. You are absolutely not alone in this. Today, we're essentially taking a hand-in-hand walk through the biology of your family planning journey. We're going to translate all that clinical data and science into plain, empowering language. All right, let's jump right into Section 1. What are hormonal imbalances? Think of your hormones simply as your body's internal messengers. They're just chemical signals that travel around, telling different parts of your body exactly what to do and when to do it. So, a hormonal imbalance, it is not a personal failure. It definitely doesn't mean your body is broken. It's merely a biological miscommunication where those chemical messengers are temporarily just a bit out of sync. Just like some people have hyperthyroidism, high or low thyroid function, or hypertestosteronemia, which just means high male hormone levels, these are simply biological miscommunications. And the best part? Doctors can easily identify and treat them. For example, take a term like hyperprolactinemia that you might actually spot on a lab report. I know it sounds incredibly complex, right? But it simply means your body has an increased level of a hormone called prolactin. And prolactin is just the hormone responsible for producing milk. That's it. When it's elevated at the wrong time, it just kind of confuses the overall messaging system. Or how about this one? Luteal phase defect. This specific imbalance simply means you have low progesterone levels in the second half of your menstrual cycle. Practically speaking, this just means the body needs a little bit of extra help supporting the lining of the uterus. Once we can actually name the problem, like, say, a simple need for more progesterone, it becomes so much less scary and highly manageable. Moving right along to Section 2, key hormones in women. In the female reproductive system, it's basically like a fertility orchestra made up of 4 main messengers. First up, we have estrogen. Its simple job is to cause the thickening of the uterus lining, preparing it for a pregnancy. If your estrogen is low, that lining just remains too thin. Next is progesterone. Its absolutely crucial job is to support the development of the embryo. A deficiency here can actually cause things like premenstrual spotting. Then we have LH, or luteinizing hormone, which is released from the pituitary gland to regulate ovulation. And finally, FSH, or follicle-stimulating hormone, which stimulates the follicles in the ovary to grow. When all 4 of these messengers are communicating clearly, they create the absolute optimal environment for conception. Now, let's switch gears for Section 3, key hormones in men. Because, as we know, fertility is a shared journey, and male factors are equally important. The male body relies on its own delicate balance of messengers. For men, testosterone is released from the testicles and drives crucial functions like libido, sexual arousal, and erections. But behind the scenes, you have LH and FSH acting as the really crucial triggers. LH actually triggers the production of that testosterone, and FSH, it's vital for initiating sperm production itself. So while testosterone gets a lot of the spotlight, LH and FSH are really the quiet messengers making the whole thing happen. Now, you might hear doctors throw around the word spermatogenesis. That is simply the medical word for the initiation and creation of sperm. So when we just talked about the hormone FSH in men, its primary responsibility is to kickstart this exact process. Okay, here is a truly fascinating and honestly kind of surprising fact. Both partners rely heavily on estrogen. In women, exactly as we discussed, it prepares the uterus for pregnancy. But in men, it's actually required for sexual function and seminal fluid production. If a man has excess estrogen, it can actually cause low sperm count, a lack of libido, or even erectile dysfunction. I think it perfectly illustrates how just one shared hormone being out of balance in either partner can completely disrupt a shared goal. All right, let's pivot to some solutions in Section 4, exploring your treatment options. Now that we actually understand the messengers, we can look at the solutions not as these intimidating medical procedures, but as incredible tools of hope. First is IVF, or in vitro fertilization. In vitro simply means in the laboratory or outside the body, giving the embryo a very safe place to form. Then there's ICSI, which stands for intracytoplasmic sperm injection. This is a truly brilliant technique developed specifically to overcome male infertility factors. And finally, genomics, like PGTA and PGTM. These are forms of preimplantation genetic testing that allow doctors to ensure an embryo is healthy before it's even implanted. Seriously, these aren't just a bunch of random acronyms. They are tangible solutions designed to correct those exact miscommunications we've been talking about. Which brings us to Section 5, taking your next step. Because moving toward action is really where the magic happens. Your path forward is honestly just 3 manageable steps. Step 1, a simple hormone assessment. Doctors just need to check the levels of those chemical messengers we covered: estrogen, progesterone, LH, and FSH. Step 2, based entirely on that assessment, your clinic will build a custom treatment plan tailored exactly to your body's specific biological miscommunication. And step 3, that's moving forward with hope. So remember, a hormonal imbalance is just a biological miscommunication. That's it, and it's one that doctors know exactly how to treat. I really hope this walkthrough has validated your feelings, simplified all that clinical jargon, and left you feeling confident and truly ready to seek the care you deserve. With these absolutely incredible medical tools waiting to help you succeed, what is the very first step you will take today to advocate for your family's future?